If you've been told that the lump you have in your palm could be or actually is Dupuytren's disease, this video will explain exactly what it is, what it does to your hand over time, and what your options are. I'm Dr. Richard Shaffer, a radiotherapy specialist and an expert in treating Dupuytren's and Ledderhose disease. Dupuytren's disease affects a layer of tissue just beneath the skin of your palm. It's not life-threatening, it won't spread to other parts of your body, and it won't affect how long you live. But it can, if it progresses, affect how well your hand works. Let's look closer at what happens with Dupuytren's and how it affects your hand over time. The first thing most people notice is a small lump called a nodule, firm and fixed, sitting there just under the skin of the palm. Most people think it's odd, but okay. And for a while, it might be. But over time, that nodule can develop into a tight band of tissue running down towards the finger. We call this a cord. And that cord has a job. It pulls. Slowly, sometimes over years, the cord begins to draw the finger down towards the palm. At first, you can't quite get the finger fully flat. Then it starts to affect everyday activities. Washing your face, putting on a glove, shaking someone's hand. In more advanced cases, the finger becomes fixed in a bent position, unable to be straightened even manually. That's what this condition can do when it's left to progress unchecked. So who gets Dupuytren's? About 3% of people in the UK, usually in their 50s or 60s, though it can appear earlier or later. You may have heard it called Viking disease. That's because it's more common in people of Northern European background, but it affects people far more widely than that. The biggest driver is genetics. Dupuytren's runs in families, but it can skip generations, so you might be the first person in your family to ever have this. Smoking, diabetes, alcohol, and repeated strain, or vibration to the hands can all increase the risk. But plenty of people with none of those factors develop it anyway. There's usually no pain with Dupuytren's, although some people report experiencing tenderness. The progression of Dupuytren's is gradual and unpredictable. Some people have a nodule for 20 years and it barely changes. Others find the finger bending within months. There's no reliable method to know which way yours will go. Not from a scan, not from a blood test, not from your family history. Here's where timing makes a real difference. In the early stages, before the fingers started to bend significantly, low-dose radiotherapy can be used to slow the progression and reduce the chance of it ever reaching that fixed, bent stage. Once the finger is significantly bent, a surgical procedure is usually needed to release the tissue and restore movement. Both options exist, but one of them requires catching the condition early enough. For a full explanation of what the early treatment window looks like, and what's at stake if the condition is left to progress, you can download my free Early Stage Dupuytren's guide. I'll leave a link in the description below. But the earlier you're aware of what's happening, the more options you have.